Hi there. Thank you once again for joining me on the program, Your Doctor in COVID. I'm Dr. Mahendra Carpen. I'm the Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. We are continuing our conversations around the COVID-19 pandemic as it continues to have a devastating effect not only in Guyana, but around the world. Today, as usual, I'm wearing the mask to cover my nose and mouth, but I'll take it off for the rest of this conversation. Remember, whenever you're in public, especially among persons who are not part of your usual circle, please remember to wear your mask. Please remember to maintain social distancing and sanitize your hands as often as possible. If you have any questions or comments regarding the COVID-19 pandemic, please feel free to send a WhatsApp to 620-6275 or send an email to docandcovid@gmail.com. So we're now in the beginning of July 2021, and COVID-19 continues to affect us all. Just recently, we have had an increased recognition in the number of children that can be affected by COVID-19. And in fact, we would have had 4 kids who were severely affected. Thankfully, these kids were all discharged from the COVID ICU as we speak right now. So we're very pleased to be getting fair and decent results as it relates to the children, because we're all concerned about children. Our best defense, our best method of fighting against COVID-19 has turned out to be the vaccination program that we are lucky to have in Guyana. But Guyana is not the only country that has had some measure of success in using vaccination. Across the world, across the globe, we have seen decreasing numbers of cases, decreasing number of deaths from COVID-19 in populations that have been vaccinated. In fact, in the United States, now that they have passed a 60% vaccination threshold among adults, we have seen a dramatic decrease in the number of cases reported as positive, as well as the number of ICU admissions, as well as the number of deaths from COVID-19. And we believe that this is a direct result of a successful vaccination program. We in Guyana have started our vaccination program since March of 2021, and we have seen almost 45 to 50% of our adult population, that's 18 years and above, who would have received at least 1 dose of a COVID-19 vaccine. And over 100,000 persons, close to 110,000 persons, would have received a fully vaccination schedule. And that is 2 doses of the vaccines that we have available. Remember, in Guyana, we have 3 vaccines available: the Sputnik from Russia, we have Sinopharm from China, as well as the AstraZeneca from the UK. And we have been using these. Recently, we have had some challenges in getting the 2nd dose of the Sputnik vaccine. But that's not unique to Guyana. All across the world, there is a challenge right now to get the 2nd dose of the Sputnik vaccine. Because what has happened in recent weeks and months, there has been a surge of positive cases in Russia. And as a result of that, they have taken a position to reduce exports of the Sputnik vaccine. As a small country, Guyana is one of those that are expected to feel the brunt of all of these shortages. When there was a spike of cases in India, India stopped exporting AstraZeneca. Now that there is a spike of cases in Russia, they have stopped exporting the Sputnik vaccine. We as small countries, we are the most affected by this. Not just Guyana, but across the globe, in the Caribbean as well. There's been some concerns about the Sputnik vaccine not being approved by the World Health Organization, but that process is ongoing, and we do expect that it will receive the blessings, or at least the emergency use authorization from the World Health Organization in the coming weeks. And not just the World Health Organization, but also other certifying bodies across the globe. There are 11 other recognized bodies that can certify and give permission for use across the world. So the WHO is not the only one that we rely on for emergency use authorization. In Guyana, we have been fortunate for a number of years to benefit from the expertise of the WHO and PAHO in this region, and we continue to benefit from their expertise and guidance. But we also recognize that there are other authorities that have been helpful and useful in shaping world opinion and providing guidelines on medical matters. So we tend to aggregate all of the information, all of the evidence that is out there to make an informed decision of risk versus benefit when we choose a particular intervention or treatment, or in this case vaccines, to give to our patients. These vaccines are not fly-by-night immediate success stories. They actually have to go through a process of rigorous investigations, of trials and testing in order to be able to pass scrutiny and to be able to be used safely in persons. So there is an extensive process of testing that goes into these vaccines before they are authorized for use. And we know that they actually work. We have seen around the world that in places where there's high numbers and high percentage of vaccinated persons, there's a dramatic decrease in the number of deaths, there's a dramatic decrease in the number of positive cases and persons being admitted to hospitals. Right here in Guyana, we have seen in households where 5 members live, 4 of them decide to take the vaccine, and the one adult who does not take the vaccine is the one who sometimes get infected and get admitted to hospital. We have not had a single death from a fully vaccinated person in Guyana. Let me repeat that. Not a single fully vaccinated person in Guyana has died from COVID-19. In fact, around the world, about 99.5% of all COVID deaths are in persons who were not vaccinated. There is no doubt that there is significant benefit in preventing death, in preventing ICU admission and intubation once you are fully vaccinated. So how was the COVID-19 vaccine really tested? Now, vaccines go through phases of clinical trials in order for them to be able to be used safely in people. So the first thing that we look for is safety. So phase 1 in the clinical trials look for safety. That is to evaluate the safety and to identify common reactions. Phase 2, after you've established safety, you look for effectiveness, where you continue to gather information on safety, but also efficacy, the dosage, as well as any reactions that would have occurred. In phase 3, we look at a combination of safety and effectiveness, where we compare thousands of volunteers with those who did not get the vaccines. So you essentially have 2 groups, and these groups number in the thousands. One group who would have had the vaccine and another group without the vaccine. And you essentially look between the 2 groups for safety as well as effectiveness. Which group is getting more COVID, which group is getting more side effects, which group is getting more admission to hospital and deaths, etc. And phase 4, we continue to monitor safety and effectiveness, where we continue to study the long-term benefits as well as the side effects that may be associated with these vaccines. So all of the vaccines that we have used so far in Guyana would have had at least 30,000 persons in these different phases of clinical trials before they would have been approved for use and being deployed in humans. How do these vaccines really work? Well, we have experience with vaccines for a number of years. Vaccines have been used to prevent diseases from polio to tetanus, measles, mumps, rubella. All of these have been success stories with vaccines. So vaccines are key to preventing diseases. COVID-19 vaccines expose the body to material that actually prompts an immune response. The immune response then helps you to build your defense mechanism or antibodies that can fight the virus. Immunity production usually takes about 2 weeks after the vaccine. So if you get your vaccine today, you're not considered to have sufficient immunity until about 14 days would have passed from your last injection. So that needs to be understood quite clearly. If you get the vaccine today, you are not expected to be immune tomorrow. In fact, you are still at almost equal risk until you develop your immunity, and that can take up to 2 weeks. So you're encouraged to continue wearing masks, continue washing hands as often as possible, and maintaining social distancing as long as you can. Now, these are independent of whether or not you get your vaccine, because as of this moment, we still recommend that all of these safety guidelines be followed, even if you are fully vaccinated. It does mean that your chances for getting COVID infection and becoming really sick would be significantly lessened by taking the vaccine. That's what it means. You still have some risk of contracting or getting infected, but you're not going to end up in the ICU, you're not going to end up on a ventilator, and you're not going to die from COVID-19 because you would have protected yourself the best possible way you can at this moment by taking your vaccines. Now, after you get the COVID-19 vaccine, now what? What should you expect? Well, you should continue to wear your mask. You should stay at least 6 feet apart from others, especially those who are not part of your regular circle. You should avoid crowds and continue to wash and sanitize your hands as often as possible. That's after your first dose. In the vaccines we have in Guyana, these are 2-dose vaccines so far. You should plan on getting your second dose, and the current ones we have, of course, as I said, require 2 doses. Even though there is credible evidence that suggests that a single dose of AstraZeneca or Sputnik can give you up to 80% protection, you want to take that 80% into the 90s. So it's recommended that you get your 2 doses. You should report your vaccine side effects by using whatever means you have to contact the Ministry of Health, your doctors, your nearest health center, etc. And if you are really concerned about your side effects, if you have generalized swelling, you can't breathe, or coughing, or excessive chest pain, etc., you should immediately contact your healthcare provider, whether it's your doctor, your health center, the community nurse. Any one of these persons or institutions can help you in order to feel better, and even if it's just to reassure you in this kind of uncertain times. So I hope that this would have encouraged persons who have not yet taken the vaccines to take your vaccines, and those of you who know persons who have not taken their vaccines, please use this information that I've shared with you in order to convince and educate those around you that they should take their COVID-19 vaccines, because it is the best defense we have against COVID-19. Remember, if you have any questions or comments, please feel free to send a WhatsApp to 620-6275 or send an email to docandcovid@gmail.com. Thank you for joining me once again.